Welcome to another educational video from Wether. It is calving season, and we waited for the perfect day to show you what calving season is really like to shoot this video. We just wanted to talk about some of the issues that can come up, some things to watch for, and see if we could help out a little bit. We've got 422 and 213 here to help us. They're our supermodels for the day. Nice, glorious pregnant moms that are getting really close up to calving. We just wanted to share with you a few things that we hope will help. So we kind of panned through the field just so you could see that that's not the best place to calve out. Lack of control gets people hurt sometimes, and so we'll get calls to come up and do, we call them dystocias. That's the word for a difficult birth or difficult calving. Sometimes you get called up to do dystocias, and we've got them tied to a truck out there. Sometimes they're running free out there, and it's just dangerous for everybody. So we encourage that if we can't get them in a trailer, can't get them to the clinic, which is the best thing to do, we've got the most options there. If we have to go to C-section, that's the place to do it, not here. But if we know that we have a pretty good chance of getting it out, and the trailer's snowed in or stuck in the mud or something like that, we're glad to come and help whatever way we can. So the best thing to focus on is making sure that they stay as calm as possible. We want them to be relaxed. We don't want them to get worked up. We don't want them to have a hard time breathing, get stressed out. And so as you move them from the field to the corral, do it nice and slow and gentle. Whisper to them, tell them how pretty they are, tell them what a good mom they are, and just help them move slowly into the corral where we can get a handle on them and check them out. Lots of times if we have a brand new producer, they're not going to know the signs of how a cow is acting when she's ready to calve. She tends to be uncomfortable. She tends to kind of separate herself from the herd, go off alone, stand up, lay down, stand up, lay down as her uterus is preparing for those large contractions. Her body will respond that way. And so just watch them if they get off on their own. And then when you can tell that they're starting to calve, sometimes they'll keep doing that. And that's a sign. Usually the most often thing I see is that the calf isn't in the birth canal. The calf has to fill up that birth canal to make sure that those hard contractions start. And I've seen that trick producers that have been doing this for 40 years. They'll think, oh, she's not in yet. But she's taking an awful long time. I just can't figure it out. Well, what's going on is you've got two little back feet up in there, or you've got a breech calf that the tail is all that's in the birth canal, and there's nothing to fill it up to tell it to stretch and cause those hard contractions. And that's where we get in a little bit of trouble when the calf, they've been in labor for 12 hours, 18 hours, but no calf. Well, that's what's going on. We need to have something to get up in the birth canal to get her set into stage 2 of labor, which is the hard contractions. So Bingham Angus Ranch has been kind enough to let us come here and demonstrate. It's important to have good facilities. There's times when we've got to the head catch and there's not much there. It doesn't catch very good. But we do have a nice setup here that we can get the cows in and get them up to the chute. If you want to pan over to, you need something sturdy enough that it's gonna help to hold them, secure them, protect everybody involved, but also we can get her out of it if she decides to lay down. The next and most important thing is you really need to teach your cows to read. If you get in the tub like this and they don't know which way to go, follow the exit sign. Okay, it's that simple. Like we were talking about, the important thing is to make sure it's nice and slow and easy. Keep them calm best you can. cow to help her feel calm, that's fine. Just make sure we can split them off before we get to the chute. I think they saw that exit sign, so we're in the right direction. One at a time, girls. So it's also important to have some place where your doctor could be safe. There's been a few times when we may need to have a back gate on there, and it slows things down quite a bit. And we want to be really focused on her and not have to worry about safety issues. Next thing, we'll go in there and we'll check her. I don't want to disturb her because she's not in labor yet, but we'll come in, check for things that calf may be malpositioned. Go in vaginally. If you are checking yourself, just make sure you got really clean hands. You know, it's worth going into the house and washing up before you stick your arm in there. If you don't have gloves. If you have gloves, obviously put one on. Still best to be cleaned up in case it tears, but put an arm sleeve on. Reach up in there and try to determine which way that calf's going. If we've got two hooves that are facing down and you've got a nose, that's great news. That's normal position. If you've got two hooves that are upside down, they're probably back hooves. Every once in a while we'll get something presented like that that's fronts, but we can figure that out. We can figure it out by the way front leg will have two hinges, two joints that bend the same way. The back leg has the fetlock that bends down and the hock that bends up. And so that's one way to tell which direction they're coming. Another thing that we find that's not necessarily a malposition, but it is impossible for her to do on her own, is when there's a twisted uterus. If you think about it, if you reach your hand in there and all you feel is that it feels like it's twisting like that, we've got a uterus that's closed off, and there's no way she's going to do that on her own. The faster you can get her to the clinic and we can get a C-section going on, the better off you're going to be. It's just nothing that they handle. It's impossible for them to get them out that way. 9:30 over here is a good mom, so she's a little worried that we borrowed her baby to demonstrate this, but just wanted to show some of the techniques for putting on chains. That is something that I kind of see some troubles with. We'll see some broken ankles every year. We'll see some chains that have been put on wrong and they've been pulled, and then they show up at the clinic and they have broken ankles. And so we need to make sure that we're just kind of coaching you a little bit on how to do that. You know, you're not going to believe if I tell you this calf's brand new today, but it's pretty new. Close up here, Bailey. The trick to getting these on is that you just drop it down through. Hold it up like this, set your loop out, drop it down through the middle of it, like that, and you get a chance to see that you're making your first loop. The trick, you know, obviously you're not gonna have this much room, but you want to reach in there, reach in the birth canal, take this in with you, slide it over the top and hook it above the fetlock like that. That's the ideal first position. Make yourself a half hitch. Put it below the fetlock like this. Okay? The way you check yourself, make sure that both knots are in the right position, is you want this chain to make a straight line out to your hand. You want it to look just like that coming up, and you're going to be tugging on this end to get that calf out. You get that on both front legs. You make sure that nose is in the birth canal, and then you can apply pressure. The strength of 2 grown men is all we need to put on there. I have seen horses pulling calves out. I've seen side-by-sides pulling calves out. I've seen winches. I've seen pickup trucks. I've seen tractors. All that stuff is going to kill one or both of them. And, you know, sometimes that's a judgment call. You think, well, if the baby dies, I can save the mom. But it doesn't have to happen. If we can just, the strength of 2 grown men, if that's not enough, if you're not making progress, and I get it, sometimes you get in the moment and you're like, I just gotta try this, and I'm just gonna try this, and I'm gonna try a little harder, I'm gonna pull a little harder. But that's all the strength that you need to put on a calf. If it won't come out through the birth canal with the strength of 2 men, then we need to move on to a C-section. We need to get that baby out of there before any damage happens to him or to mom. So this little guy's a little too tough for me to throw around, but if you've ever been in a situation where the calf got hip locked, yeah, I just wanted to help you with some strategies for that. And if you think about it, think about a rectangle and a rectangle. Her pelvis, her birth canal, is a rectangle that's going up this way. His pelvis is a rectangle that's going this way. And lots of times we'll get to this point and we get the rectangle locked. The best thing you can do in that situation is just turn this calf 90 degrees. Okay, if you think of him coming out this way and he's getting stuck in there and you've got everything out, the umbilical cord's getting pressure on it, so he's not getting nutrients that way. He's also not breathing really well yet. The best thing you can do is just take those chains, turn them 90 degrees so that you're straight up and down instead of horizontal, you're vertical, and then keep pulling. There might be some up and down, but you want to pull that calf straight out and then down to get him to where those hips are coming up in through her pelvis, and then turn 90 degrees to get those hips to come past. And that's going to help a lot. If you've ever had a hip lock and been frustrated with it, I mean, I even had a cow show up one time with a calf hanging out by its hips because it was so stuck. And it really did just take a turn to get the calf out. By that time, it was so swollen, it was tough. I had to go in and turn the shoulders themselves to try to get the hips to follow, but it'll almost always work. Okay, so once he's out, once he's down on the ground, a few little tricks that we use to try to get him to feel well is we'll pinch their nose. There's not a lot of research behind it, but there's some acupuncture points that are in the tip of the nose that help them to want to breathe. So I'll pinch their nose really hard, and I'll even take a needle and stick it right in that line in between their nostrils. Hey buddy, come back. In that line right between their nostrils to give them a chance to work on that pressure point. The other thing is, I know Grandpa did it, and Dad probably did it, and maybe you've done it, but there's lots of tendency to want to hang the calf on the fence because of all the fluid that comes out, and we feel like we're helping their lungs. Research has shown that fluid almost always comes from the stomach. And you're really inhibiting their ability to breathe because you're putting all the pressure of the GI tract on the lungs and giving them a hard time to breathe. So it's actually better when you're trying to get those calves to breathe to kneel over them. You want to kneel over them, kind of set them up so they're sitting up straight. You're too lively. All right, we got a little fresher calf. Can I show this? But sometimes when they come out, they're having a hard time breathing. You know, lots of times you'll take a piece of straw and stick it up the nostril. That also stimulates them to want to breathe. One of the best things we can do is get the lungs really working. We like to do what's called coupage. I don't know what it means. It's French, but you cup your hands like this and you clap along the sides all the way up from the back of the ribs to the front of the ribs, back to front every time. And it helps to dissipate some of that fluid that gets down in the lungs, some of the amniotic fluid. It helps to push it down and out into the tissues of the lungs instead of being in those small airways which is where respiration happens. They got to have those little alveoli at the tips of the bronchial tree to open up so they can get oxygen to pass through into the bloodstream. And so we'll come, set them up like this. It's best if they're sitting up, even if their head's flat on the ground and they're not really responsive. Okay, and you'll come and you'll clap them like this. But be rough. You know, sometimes we're a little too soft on these guys, and we forget that they just went through some pretty serious trauma coming out of that birth canal. You need to hit them pretty hard to get them up and going. It worked! So after you've got the calf out, you've got it breathing, it's up, it's moving around. You can put a little weak iodine on the belly button. Sometimes people use strong. That doesn't work out as well. We actually see more naval infections with strong iodine than we do without putting anything on it at all. And that's because it will dry out the outside of the umbilical cord, and it'll cause that to fall off, but it leaves the inside wet. And so they tend to get more infections if we use strong iodine. So use weak iodine or betadine to dip the navel. And then, you know, of course, her job kicks in even more now because she's got to start providing all the nourishment and protection for that calf. That comes through the colostrum. They got to have colostrum. If you have any hesitation at all, if you think that calf's not getting them, give it a tube it, give it some colostrum. If you don't feel comfortable doing that, we do. Bring them in and we'll put a tube down into their stomach and deliver the colostrum from a bag or from her if you bring her, and you can milk her out. And we'll put that directly in and make sure that that calf gets the colostrum that it needs. And that'll set it up for success its whole life. They've done research studies to show that calves that don't get colostrum aren't just sick like in the first 30, 60, 90 days. They're sick, they're behind their whole entire life. They don't perform in the feedlots. They don't do as well as other heifers do when they produce their own calves. They just have a hard time, and that is key in making sure that they have a good life, is the colostrum. We appreciate you joining us today. We hope you like this video. We hope that it was educational and informative to you. We really appreciate you. We love working on cows. We love taking care of them. It's a huge highlight this time of year to start thinking about pulling calves and getting them going, helping out with your goals as a cattle producer. I just want to say thank you to 422 and to 930 that helped us with their calves, gave us an opportunity to have some good models to help, and to the Bingham Angus Ranch for letting us be here. Again, if you have any questions at all, the rule of thumb is just don't wait too long. The wrecks that come, the sad pulls are when I reach in there and I can't get any response out of that calf and they're dead before they get to me. If you got to set a timer. I do the same thing. You get in there and you start, I can do this, and one more little push and I'll get it, and I won't have to call the vet. But it's really important to think about time. I set myself a timer when I'm working on getting a calf out the back end, because if it doesn't come out within about 10 minutes, then I need to go. I need to go to the side and get it out through C-section. I don't want you to think I don't trust you. You know, there's lots of producers that do a great job of getting their calves out and stuff, but don't wait too long. That's the biggest problem that I see overall in calving emergencies, is that we just wait too long and then we have a poor outcome. So get them into us. We'll get them into the clinic. When it's 30 below out here, it's 72 in there, and we can get that calf out, get it dried off, get it set off on the right feet, on the right foot to have a successful life. And that's what we want to do. And we love what we do. Thank you.